Good afternoon once again. This is Dr. Bhupesh from Dr. BKM Institutes recording another question for the day. Please subscribe our channel if you have not by chance and contact us on 76967 for the best OET coaching. Coming back onto this seventh question, and thanks to the creators of question paper, most probably it's from Cambridge Box Hill. So thanks to them for creating this question paper. Again, being Dr. BKM Institutes, our job is to tell you how to do it. So in the first paragraph, what point does the writer make about CVD? So the only question they have asked me is this word CVD. CVD is the only word I want to focus. So that is how you can easily do readings when you focus on the right word, that is CVD. CVD, cardiovascular benefits of exercise. CVD means cardiovascular disease. Cardiovascular disease is the leading cause of death for both men and women in the United States. According to AHA, by year 2030, the prevalence of the CVD in USA is expected to increase by 9.9%, and the prevalence of both heart failure and stroke is expected to increase by 25% worldwide. So in USA, 9.9, worldwide 25% it will increase. It is projected that CVD will be responsible for over 25 million deaths. Always read these words very closely. Over 25 million deaths per year by 2025. So these are the future projections that CVD is a dangerous thing. In future, it can affect 25% people worldwide more, and also it in USA it is expected to increase by 9.9%. So that means CVD is very dangerous, and in the future it can be even more dangerous. And yet, although several risk factors are non-modifiable, like age, gender, family history cannot be changed, the majority of the factors always, I was just teaching you, I did not record in the last thing. I was telling you in the last question as well, when we did the question of new visibility, new word is very important. In these cases, over word is very important. Increase word is very important. Then majority word is very important. These words tell you, they will play with you on these kind of words. So the majority of read the whole line. Although several risk factors means many risk factors are non-modifiable, means cannot be changed. The majority of the contributing factors are amenable to intervention, means we can intervene. Doctors can intervene. Humans can intervene. Intervention over here means that they can interfere in this process. That means they can slow down the CVD or reduce the CVD. These include elevated blood pressure, because it is in human control. If we will not eat salt, we can control our blood pressure. High cholesterol, smoking, obesity, diet, and excess stress. We can reduce all these things by human effort. Aspirin taken in low doses among high risk group is also recommended for it. So the overall paragraph says about CVD that CVD is a dangerous disease and can affect more people in the future, but it can be reduced because majority of the factors are controllable. So let's see if any option like this is given. Measures to treat CVD have failed to contain. There is nothing that talks about treatment. There is nothing that the treatment has failed. Eliminated. This is elimination. Treatment, no, it does not talk about treatment, and it does not talk about failure of treatment. Eliminated. There is a potential for reducing overall incidence of CVD. Potential means, again, future, that we can reduce the CVD. Yes, we can reduce the CVD because many factors, majority of the factors are controllable. So there is a potential, but now vocabulary change is maximum in this option. Let's see other C option. Effective CVD treatment depends upon patient cooperation. There is nothing about patient cooperation, but it can confuse you a little that patient cooperation means that majority of the factors are amenable to intervention. That means patient cooperation is required. But again, this paragraph did not have the word effective. This paragraph did not have the word treatment, and there was nothing. It was saying that effective CVD treatment. Effective word is also not given. Treatment word is also. So these options can confuse you sometimes, but try to focus that effective treatment word is not given. They are just talking that many factors are controllables. So effective CVD depends upon the patient cooperation, nothing like that. Genetic factors are nothing like genetic factors. They were saying genetic factors are likely to play a greater role in controlling CVD. They were saying that several factors like genetic factors do not play any role in controlling because they are uncontrollable factors. I will show you. Because they were saying where genetics was given in the bracket age, male, gender, race, family history, or genetics. But they were saying these factors are non-modifiable. So it means genetics is not going to play any role in controlling this CVD. So that is how you do these easy questions. This is Dr. Bhupesh once again teaching you how to do reading easily. You don't have to pressurize even. Just try to read over here anywhere effective treatment word is given, then you will realize how easy it is to eliminate, because they are not talking about that effective treatment depends upon patient cooperation. Nothing like this is given. It appears because the B option they have modified a lot. That is why I say elimination method is the best and the easiest method, because you do not find the word effective treatment, eliminate it. Then you think about there is potential to reduce CVD. Yes, there is high potential because majority of the amenable factors are amenable, and these include this and this. Aspirin also can be used to for its cardiovascular benefits. So I think it should be the answer that was being talked about. So I'm just going to stop the recording and take your help. Thank you.